Well, this time of year can really be hard for people struggling with substance abuse disorder. Many of us are likely to be inside a lot, right? And that can spur feelings of isolation from supportive friends. Ultimately, that can lead to relapse and even just not getting sunshine. We know that that affects us. Joining me with some important advice on how to support family and friends with substance abuse disorders, Don Schroeder. He is the CEO of Recovery Centers of America for Indianapolis and kind of a newer CEO.
Yes, ma'am.
Right? So
yes.
It's so good to have you here because the need is so great. We know that. We talk about it all the time. But why is February? Can you go into a little bit more specifics on why this can be sometimes the hardest month for a lot of people?
Absolutely. So springtime, as spring approaches, individuals have been stuck in the house. So they are actually getting out into the community now. So they have more access to drugs and alcohol, which is a significant challenge. In addition, seasonal affective disorder really affects people. So it's just like depression. So seasonal affective disorder basically is lack of sunshine. So it's a challenge and a struggle. So they turn to drugs and alcohol to basically overcome that.
It is a real thing. That is too with the sunshine.
Yes.
And even if you can go outside for 10 minutes on a sunny day, that can actually elevate. I mean, you're a clinical psychologist. I think you know that what that naturally can do for you helps. I know 85% of the time you were telling me that substance abuse disorder coexists with a mental health issue. Is that, I didn't realize it was that high.
It is. And anywhere from 70 to 85% of patients seeking services have both substance abuse disorder and also mental health disorder. So integrated care is one of the priorities in Indiana and also with Recovery Centers of America. So integrated care is basically being able to treat both disorders at the same time. So one person has two disorders, we treat it at the same time. And Recovery Centers of America really promotes and follows through with their integrated care model.
I think that's really important because maybe somebody goes to one and maybe they can't treat the other.
Correct.
That is a big deal to probably, because if you're treating one and you're not the other, is getting treatment for one even working at all?
It's a challenge. So relapse is a big issue in substance abuse treatment. And so what we want to do is if we're treating both sides of the disorder, then relapse rates go down.
Okay, I wanted to dive into this number because I read this yesterday and it was a little bit concerning. Governor Holcomb requested $347 million for mental health and SUD treatment initiatives. And then I understand that has maybe been cut back. We're trying to kind of see where this law may be working. What is your knowledge of what is happening right now?
So my understanding is they've cut the bill about in half. So the services that are needed in the community to meet the need, as we went through COVID, the need has increased dramatically. So my understanding is they've cut that number down to somewhere around 130 million.
It looked like, from what I was reading, that maybe they were going to say, okay, we're going to give half this year and then maybe the next half next year. So they'll do it over 2 years instead of one. And it seems like, though, we need a lot of help right now.
We do. And having mental health and substance abuse initiatives is fantastic. I mean, it really is. It really impacts the community and gives people the opportunity. Unfortunately, 4,000 people in Indiana have died of overdoses, and we really need to impact that. In the United States, over 100,000 people last year died of overdoses, and we can stop that.
Yes.
We can really get in there and hit that.
We have to.
We do.
We have to do it. We focus a lot on the fentanyl overdoses here. We're going to have a special on that actually coming up in a couple of weeks. I'm out of time. Maybe you'll be part of that with us too, but I want to let people know if you would like to get in touch with the Recovery Centers of America and again get treatment at the same time. Maybe it's somebody you know. We'll connect you at fox59.com/links. We'll get you hooked up right there to try to get the treatment that you need. Thank you.
Thank you.
And I'm glad you're now in Indiana helping so many people out.